Pap smears. I used to dread going for pap smears. One of the main reasons was because I never felt entirely comfortable with a gynecologist, so the entire process wasn't really pleasant. It wasn't a bad experience. I would leave the doctor's office just feeling a little bit clueless, but hoping for a good result. And now I've found a great gynecologist and it's made such a huge difference. I feel comfortable asking questions, so I know my body better, and that makes me feel much more empowered. And I think it's our own responsibility to have all the information to make the best decisions for our physical, mental, and emotional well-being. I'm Xandria, and this is my story.
It's 2022. Half the population are women, and yet so many of us are uncomfortable discussing the truth about our bodies, about how they work and how they don't. And that's why we're celebrating Her Stories, a series that explores the physical, emotional, psychological, and social forces that influence female bodies and how we can strive for better health and happiness. This series, we interview real amazing women who have all gone through life-changing experiences. This special series was brought to you by Sunway Medical Centre in conjunction with International Women's Day. I'm your host, Cheryl Samad, and today we have two lovely guests with us. One is a writer. She is a TV and radio host as well as a motivational speaker. And the other is a wonderful doctor. She is a gynecologist and obstetrician and also specializes in maternal fetal medicine. We have Xandria and Dr Janani Sivanathan. Hello.
Hi.
Welcome to SET. I'm so happy to have you here.
It's so good to be here.
Is it? And you are like super pregnant. And I'm so happy to see it. Actually, Xandria, I've known you for years, right? And when I found out that you were pregnant, I was like, I'm so happy for her. Congratulations.
Thank you.
Yes.
So it's been 6 months now.
Okay.
And Dr. Janani is my gynecologist.
That's right.
Yes. So she knows everything there is to know about my pregnancy, and it's so good to be here together.
So today we have Dr. Janani here as well because we are going to discuss a topic that I feel more women should talk about, which is the importance of choosing the right gynae for you. Like for you, for instance, Xandria, I know you go for regular checkups before you met your dream.
Yeah,
gynae.
my dream gynae.
Your
you
dream
also know
gynae.
she's my dream gynae.
But how important was that for you?
Well, I was never really comfortable going to a gynecologist, but I knew pap smears were important, so every couple of years I would remind myself, Xandria, you've got to make an appointment, you've got to go, but then you procrastinate because it's not pleasant, And then I remember I had to do a pap smear early this year. And one of our doctor friends recommended Dr. Janani in Sunway Medical. And we hit it off immediately. Yes. Behind our masks.
Yes.
We were wearing masks some more at the time. Yeah. And there was chemistry.
There was a connection, yeah.
Yes. And I think it was because I felt really comfortable asking her questions and I didn't feel stupid asking basic questions.
No, I think that's important. When you ask a doctor a question and when they don't make you feel incompetent, right? That's very important to me as well. Then I know that I can ask her anything I want and she will just treat me like an adult.
Yes. I actually had a polyp removed.
Oh, you did? Okay.
Yes, and that was when I knew I was so comfortable with Dr. Janani because the entire procedure went so smooth. I didn't feel self-conscious. And I was like, hey, this is an entirely new feeling, And then my mom was there with me at the appointment and she was like, okay, now you found the right gynecologist, you can get pregnant. And 2 months later, I was pregnant. So when I'm with her, I don't feel like you're doing work, actually. I just feel like you're so interested. And you're like, oh, let's just check.
I think that's it. You're interested.
Yes.
Right? She's interested in her patients.
Yes. And she enjoys the process too, I can tell. And her office, the environment, the music you play, her nurse is really
you got
lovely.
music also in your office?
Yes.
Wow.
Yes. She has a playlist.
I only hear music like in the waiting room and never in the consultation.
Waiting room, I don't know whether got music. No, I don't think so.
Yeah.
And her nurse is lovely.
Aromatherapy.
Wow.
Yeah.
So you walk in, you're like,
calm.
I'm calm. Yeah.
And her nurse reflects her demeanor as well. So she's also very calm, very pleasant. So I really enjoy, honestly,
going for appointments.
I super love it.
Dr. Janani, do you think that there is a correlation between patient-doctor rapport and patient outcome?
Yes, definitely. I think it is very important to have trust in a patient-doctor relationship because that will improve patient outcome. Previous patient-doctor relationships were more like paternalistic, yeah? So where the doctor says something and then you follow, kind of thing. So we are moving away from that and giving back autonomy to the patient. I think that's where we should go to. So you give them all the information that they need with regards to their health, and the patient makes the decision, as in, yes, this is what I want, and can we proceed in this way?
We go for pap smears a lot of times. We don't even know why we're going for pap smears. We just know that we have to do it. It's a screening that needs to be done because we're women. But what exactly are you looking for in a pap smear, and how often should we do it?
Basically, a pap smear is one of the best screening methods to screen for cervical cancer. Okay, so it should be done as soon as a woman is sexually exposed, or from the age of 20 up to 65. Okay. And what are we looking for is actually to look at precancerous cells or any change in the cervix, as this can become cancer. So the duration is like, it should be done annually. And if you have 2 smears which are normal, then you can move on to doing it every 3 yearly.
Right.
And in addition, now we have the HPV, which is the human papilloma virus, and this virus is the one that causes the change in the cervix. Right. And there's also testing for that now. Okay. So that testing is done every 5 years. Right. So if there is HPV, if a person is infected with HPV, then the pap smear has to be done every year.
I'm going to ask Xandria now. Xandria, you've gotten pregnant at the age of 38. What would your advice be to women who look up to you about getting pregnant past 35?
Well, just try. You know, I think there's no harm trying, and there's a big difference between hope and expectations.
Exactly.
You know, I think when we have hope, we have a vision of what we want, and we have plans, and you feel excited by it.
Yes.
And expectations, it's where if it doesn't come to fruition, if what you plan did not turn out, you know, the outcome is not desirable, then you start to feel guilty, or you feel like I'm a failure. You know, what did I do wrong?
Yes.
You know, I pray every day.
Just don't be hard on yourself.
Yeah. You know, and I think that's really hard to get out of, because that can spiral downwards into anxiety and depression, and there's a lack of acceptance, right? But when we have hope, it's just kind of like, hey, you know what? Life is going to happen anyway. So why not have hope and just try to have a child?
Yes.
And don't judge yourself.
Yes. But what do you tell your patients, Dr. Janani, if you see a mother who's tried multiple times to get pregnant and she can't get pregnant still? She's tried every avenue possibly available to her. What would you then tell her at like the tail end of her journey?
I think what's important here is that this labeling of advanced maternal age was something that was conceived way before. But nowadays, women are, career women. They are, concentrating on their careers. They probably are the sole breadwinners of the family. Lots of things to concentrate on. And so, getting pregnant at an older age is something becoming a norm. Yeah, so like 40s, I see a lot of patients in their 40s getting pregnant now. So 40s is the new 30s. Yeah.
It's a new norm.
Yeah, so there's not an issue, but as long as they are followed up well, then there shouldn't be a problem with the pregnancy. So if you've come to that stage where you've been trying for a few years and there's nothing happening, don't just not do anything about it. Go and get it checked.
Dr. Janani, you are also a specialist in maternal fetal medicine, right?
Yes.
So I wanted to ask you, what constitutes high-risk pregnancy?
High-risk pregnancies, there are a few factors that come under high-risk pregnancies, such as very young age, less than 17, or age more than 35, body mass index of more than 30.
Okay.
And women who've got medical illnesses such as underlying diabetes, high blood pressure, kidney problems.
Or even like breast cancer, right?
Yes, even breast cancer, cancers, autoimmune diseases like SLE,
okay,
rheumatoid arthritis, if they've undergone a kidney transplant. So these women come under the high risk category if they do get pregnant.
What about twin pregnancies?
Yes, so there are two parts of it. One is maternal and one is fetal. Yeah, so maternal part, these are all the ones involving the lady. For the fetus per se, if it's a multiple pregnancy, twins, triplets, then you know the risk goes up. If the fetus has a problem like a structural problem, a defect, then that becomes high risk as well. And then it also depends on the placenta. So sometimes the placenta is unhealthy, and that puts the pregnancy at high risk of having growth restriction, the mother developing condition known as preeclampsia,
Yes.
and things like that.
Preeclampsia, isn't that when you get high blood pressure?
Yes,
When you
so you get
deliver?
high blood pressure towards the later part in pregnancy, you get swollen because you're losing protein in the urine, things like that. So we can test for all these things, the likelihood of preeclampsia occurring at the early stage in the first trimester of pregnancy.
Oh, really? You can test?
As we
Yeah.
did for
Yeah.
you, yeah. And if your risk is high, then we can do certain things like starting prophylactic agents, that means to prevent preeclampsia
I see.
or reduce the severity of it.
So
by
it's
taking-
medication?
Yes, by taking aspirin
I'm taking aspirin.
Are you? Okay,
Yeah.
okay.
and calcium supplementation also happens.
Do you find that a lot of your patients, especially when it's a fetal issue, that a lot of women blame themselves?
Yes.
Right?
It's the same as
my-
miscarriages as well. You feel like it's
Yes.
your fault. You've contributed to
But
it.
you see that it's pretty common, right? Like miscarriages is really common. Even preeclampsia is common, right?
Yes, preeclampsia is common, but when you touch about fetal problems, yeah, the first thing that the mother would feel is that, you know, I did this to my baby. So it is very important to reassure and to say that she could not have done anything or changed the outcome by changing anything.
When you see a gynae, when you see your gynae for the first time, or maybe after many, many years, what are some of the more important questions that you need to discuss with your gynae?
Gynae, like we say, we look after from womb to tomb,
Right.
right? So from
Wow, that's quite morbid, but yes.
pregnancy,
But it rhymes.
But it rhymes, yeah.
yeah, so from pregnancy and then adolescent, and then you know, when you are going to get pregnant, the pregnancy itself, and then when you go into perimenopause and menopause.
Yes.
So there are lots of stages. So when we talk about what should they ask their gynae, so it depends on at which stage they are.
Correct,
So
yeah.
ideally, once you are in your mid-20s or 30s, see your gynae, discuss regarding your sexual health, you know, contraception. You have to take responsibility over your own body. Yes, and subsequently, if you're keen for a pregnancy, ensure that you are at an optimal health preconception before you get pregnant, so that you don't have much complications
Yes.
when you're pregnant.
Correct, yeah. I really feel like I went to school today. I feel like I learned so much today about...
Don't you want to change gynaes now?
Yeah, you know, I'm thinking maybe I should make that trip to Sunway Medical Centre to see the wonderful Dr.
And listen to
Janani.
relaxing music.
That's right. But thank you so much for sharing with us everything that you know, and thank you, Xandria, for sharing with us your experiences and you know, and just being you. It's nice to have you being so optimistic about just life in general, right? She's so full of optimism.
Yes,
This one.
I learned a lot from her too.
Thank you so much, Cheryl. It's always a joy to see you and speak with you.
Thank you so much. And thank you so much for all of you watching today. Remember, you can share your stories too on #SunMedHerStories. And you never know if you could be helping someone who's watching today. You can get all the resources on our website about our guest as well, and also on women's health. See you in the next video. Bye.